this result from doing that. Very simply, large amounts of vaccine, large amounts of, like vats of vaccine, are currently pumped into your child's body. And we're doing 20% of that at each visit. And we'll let time elapse between visits so the body can handle this massive amount of fluid being pumped in. I think it's going to make a big difference. You know, there are some groups that have virtually no problem with autism. And they, you know, I have to say this, they're groups that aren't big into the world of vaccines. So there's something wrong when we see record numbers all the time, every year for years and years. Every year gets higher, higher, higher autism. And we think we have a very good recommendation, and a lot of good things are happening. We're going to be releasing some very detailed paper. Here's another one, European countries versus the United States. Look at that. These are high-level, very medically powerful European countries. You see the top, that little chart says a lot, but that's the difference. So with that, I'd like to have Bobby say a few words, please, and then we'll go to the others. Please, Bobby.
Thank you, Mr. President. I want to start by just reinforcing something the President said, which is the source of his concern about this issue. And I'll just give an example. In 1970, the biggest epidemiological study at that time in history was performed. And the university scientists from across this country looked at all the 8-year-olds in Wisconsin, about 900,000 children. And they were looking for autism, and they knew what autism looked like. And they came back with an incident rate of 0.8 per 10,000. So less than 1 in 10,000. The rate, according to CDC today in this country, is 1 in every 31 children. In California, it's 1 in every 19 children, 1 in every 12.5 boys. So there has been a dramatic increase. One of the things that the industry likes to say, one of the talking points, which the press loves to parrot, is, oh, we're just noticing it more. But this is an absurdity, and this is an assertion that has been debunked again and again and again by peer-reviewed literature. But it's also debunked by common sense. Because if we were just noticing it more, we would notice it in older groups, but we're not. We're only noticing it in kids who were born around 1989 or after. The older generations, you're not seeing those increases. So something happened in the mid-90s that changed our children, and it has to be an environmental exposure. Because genes don't cause epidemics. It can provide a vulnerability, but you need an environmental toxin. And what the President has charged us with is finding which one of those exposures or which collection of exposures are causing this epidemic. For decades, I fought for a simple principle. When it comes to the health of our children, government has an obligation to follow the evidence wherever it leads. Tell the American people the truth and give parents the information they need to make informed decisions for their families. Mr. President, you gave us a mandate to do just that. You directed HHS to examine America's childhood vaccine recommendations against the best available science and the practices of other developed nations. We did that work, and on January 5th, HHS and CDC overhauled the childhood immunization schedule, reducing the number of diseases universally recommended for vaccines from 17 to 11, and establishing distinct categories of recommendations based upon the scientific evidence. Our assessment found that the United States recommended more childhood vaccines than any other peer nation. President Trump mentioned the number that's 72 jabs before 18, but it actually could be up to 94 jabs. And nobody else has anything like that. And then many other countries, or most other countries, achieve high vaccination rates through education, informed consent, and public trust rather than mandates. Today, with this executive order, you are building on that work and acting on that evidence. We will preserve access to vaccines, strengthen safety monitoring, expand research, give doctors and parents better information, and restore informed consent and parental choice to their rightful place in American medicine. At HHS, we are already moving across multiple agencies: FDA, CDC, NIH, ARPA-H, NTP, the National Toxicity Program, and other parts of the department. We have already launched unprecedented research effort examining vaccine safety and long-term health outcomes in American children. We are putting some of the largest health data sets in the country to work, including CDC's Vaccine Safety Data Link, FDA's BEST systems, and other major federal and private health data sources. We're pursuing dozens of studies and analyses. We are comparing health outcomes in vaccinated versus unvaccinated children. We're examining aluminum adjuvants, the timing of the hepatitis B vaccine, vaccines administered during pregnancy, and outcomes ranging from allergies to autoimmune disease to autism and other neurodevelopmental disorders. At NIH, the National Institute of Allergy and Infectious Diseases and the National Institute of Environmental Health Sciences are working with the National Toxicity Program on a comprehensive review of vaccine adjuvants, ingredients that are added to vaccines to amplify the body's immune response. They will determine what the existing science establishes and where uncertainty remains and where we need additional research. We're bringing that same determination to autism. NIH has launched the Autism Data Science Initiative with 13 research awards examining autism prevalence, causes, treatments, and services. 5 of these will include vaccines among the potential factors that they examine. Dr. Bhattacharya will discuss that work in greater detail. Next month, ARPA-H is preparing a major new initiative focused on foundational causes and biology of autism and on better diagnostics, treatments, technologies, and tools for people with autism and their families. We will examine every biologically plausible hypothesis and leave no legitimate scientific question unexplored. Mr. President, you have told us that you want answers, so do I. We have just over 2 years to finish the work, and I know you're impatient, and we are moving with the urgency that deadline demands. We will bring you actions and findings as soon as they are ready. We will not wait for the 90-day period, and within 90 days, as you have directed, we will deliver the full response required by this executive order. Our task force on safer childhood vaccines was established by Congress in 1986, but went dormant in 1998. Last year, after nearly 3 decades, this administration reinstated it as required by the statute, and yet it was discontinued. And you restored that congressional mandate. The task force is already working to expand vaccine options, strengthen safety monitoring, advance research into alternative adjuvants, and continuously evaluate risks and benefits using American and international evidence. Taken together, this is what gold standard science means. No predetermined answers, no institutional taboos, no sacred cows, no hiding uncertainty. Test the hypothesis